This is TTT Live. I'm DK Rosta. The Ministry of Health is giving an status update on COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Senior Corporate Communications Officer at the Ministry of Health, Al Alexander.
Good morning, Trinidad and Tobago. Welcome to the Ministry of Health's virtual media conference on the national COVID-19 response. It is a pleasure to be here with you once again. Today on our panel, we have Dr. Miriam Abdul-Richards, Principal Medical Officer, Institutions, Dr. Avery Hines, Technical Director, Epidemiology, and Dr. Adish Sirji Singh, Director in the Directorate of Women's Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for today. Dr. Abdul-Richards will provide us with the latest clinical update and report on the status of the parallel healthcare system. Dr. Richards.
Good morning. Good morning, Mr. Alexander, Dr. Hines, and my colleague, Dr. Adish Sirji Singh. Good morning to members of the listening population, the media houses, and any others who may be tuned in via social media or otherwise. This morning, I'm pleased to provide an update on the clinical status of the parallel healthcare system, which is part of the national response for the COVID-19 pandemic. Prior to my update, I would like to recognize and thank the efforts of all frontline staff that have been managing the parallel healthcare system from March 12, 2020. This system has grown from 1 hospital and 2 beds to 23 centers across 3 to 4 levels of care and 1,641 beds. The parallel healthcare system continues to engage the efforts and is supported not only by the Ministry of Health and clinical persons and physicians, nurses, etc., but also by the Ministry of National Security through the Trinidad and Tobago Defense Force and Immigration, and the Ministry of Finance through the Customs Department, as well as persons from the Airport Authority and the Civil Aviation Authority. So I'm moving on now to the update on the parallel healthcare system. At present, the parallel healthcare system has had 36,241 persons who were tested as of 4 p.m. yesterday. There have been 6,488 positive cases recorded since the first case on March 12, 2020, up until 4 p.m. yesterday. We've had a total of 5,639 recovered patients and 734 total active positive cases. The total active positive cases are spread between persons who are in home isolation, which is 648 persons, and these are persons who have tested positive for COVID-19 but are considered to be low risk due to mild or asymptomatic symptoms and the absence of coexisting medical problems such as diabetes, hypertension, and lung diseases. It is noteworthy to identify the officers of the County Medical Officer of Health who manage and monitor these patients via a telemedicine approach with support from the Trinidad and Tobago Police Service. The persons' total active positive cases also includes persons in step-down facilities. At this point in time, we have 28 persons in step-down facilities, which are facilities that manage patients who are COVID positive and who have some element of risk factors. For example, persons from vulnerable populations, persons who are elderly or have coexisting medical conditions. We have 2 step-down facilities that are currently operationalized. One step-down facility is the Claxton Bay Correctional Facility, which has 17 patients, the other being the Day Bay Academy Facility, which has 11 patients. We also have a total of 45 patients in hospital. The Couva Hospital and Multi-Training Facility has 33 patients, 2 of which are in ICU and 8 of which are in HDU. The Quora Hospital has 11 patients and the St. Anne's Hospital has 1 patient. At present, we have 123 persons who are in state or state-supervised quarantine facilities. As of 4 p.m. yesterday, we have 7 out of 10 facilities operationalized, with the next 3 facilities being operationalized within the next 2 days to accommodate repatriated nationals from the United States, Miami that is, and Barbados. Thus far, we've had 115 deaths, and on behalf of the Ministry of Health, we would like to extend condolences to the families of these deceased persons. Over the last 24 hours, we reported 13 positive cases, which were verified by our labs and the Caribbean Public Health Agency. Please note that of the 648 persons in home isolation, 174 are under the care of the prison system and are being managed effectively by the Ministry of National Security. I would like to speak about the benefits of the parallel healthcare system at this point. The parallel healthcare system was operationalized on March 12, 2020, when we diagnosed the first case of COVID-19. That initial patient was hospitalized at the Cora Hospital. The major benefits of the parallel healthcare system is that it allows the traditional healthcare system, that is through the RHAs and hospitals such as the Port of Spain General Hospital, the San Fernando General Hospital, the Sangre Grande Hospital, the Point Fortin Hospital, to continue unabated with their levels of care. For example, treating patients with diabetes, hypertension, and persons who require emergency care and urgent and emergency surgery. The parallel healthcare system prevents the cross-infection of patients and persons from these facilities, given the high infectivity rate of COVID-19. Another benefit of the parallel healthcare system is that it allows for specialized levels of care, since there are specific specialties that manage the COVID-19 pandemic. So, for example, we have a skill set that concentrates on persons with specialties in pulmonology, intensive care, anesthesiology, family medicine, and primary health care. At present, the parallel healthcare system has an overall occupancy of 13%. And when we speak of this percentage occupancy, we are looking at the number of persons in hospitals that manage confirmed cases, hospitals that manage suspect cases, such as the Arima General Hospital and the Augustus Long Hospital, persons in state and state-supervised quarantine facilities, and persons in step-down facilities. Despite the low overall occupancy of the parallel healthcare system, we have to consider that we anticipate a spike in cases due to post-Christmas and post-New Year's activities. Additionally, the ambulatory capacity, which is the capacity for persons who may require medical care that is not considered severe or critical, that is ward-level patients, is currently at 14%. Our HDU percentage as of 4 p.m. yesterday, with regards to occupancy, is 19%, and our ICU percentages are at 8% with regards to the occupancy. It is important to note that we have several repatriation flights that have been scheduled over the next 2 weeks. Tomorrow, we have approved approximately 120 returning nationals from Miami, and these persons will be accommodated in a mix of state and state-supervised facilities. The parallel healthcare system has to take into account several factors and consider that these are nationals from high-risk countries, and so we must have accommodations in the event that a large number of persons test positive. Additionally, we have a repatriation flight from Barbados, for which the Ministry of National Security has granted approval for yet again 120 persons. This number, again, will dictate how the parallel healthcare system is used, because we have to have strategies in place for containment of persons who are COVID-19 positive. On behalf of the frontline staff of the parallel healthcare system, which encompasses persons from the Ministries of Health, National Security, Finance, and even local government, I am asking the population to desist from gatherings over the Christmas period. International evidence suggests and identifies that any sort of gathering exercise can increase the transmission of COVID-19. And on Monday, Dr. Hines, my colleague, stressed that this contagiousness or the infectivity of COVID-19 transcends social classes. With this in mind, the Ministry of Health urges members of the population to desist from large gatherings that may be considered unnecessary at this point in time. This activity would really assist us in keeping our population safe and healthy as we move towards the Ministry of Health's strategic objective, which would be to reduce the community spread of COVID-19 back to cluster transmission. Additionally, on behalf of the Ministry of Health, I would like to urge members of the population to be vaccinated for the influenza virus. At present, the Ministry of Health has distributed 70,000 on average vaccines, and we are asking persons to have their vaccines administered by the first quarter of next year. That is before March. We would like to have this vaccination drive done before the usual time, or which is usually in May, given the possibility of our country receiving the COVID-19 vaccine. In closing, I would like to remind members of the population of measures that we can all take to mitigate or reduce the spread of COVID-19. We would like to remind members of the population about the appropriate wearing of masks in all settings. Additionally, the use of social distancing, and this was pertaining to my point about gatherings of persons, the use of hand washing and sanitizers. We also would like to urge persons to stay at home and contact the Ministry of Health's hotline at 877-WELL if they believe that they have viral symptoms. In such cases, persons should stay at home and practice measures to self-quarantine themselves, that is, avoid contact with relatives. Personal responsibility is key in keeping our population safe. Once again, on behalf of the Ministry of Health, we would like to thank the population thus far for adhering to our recommendations and for their patience and collaboration as we strive to keep our country safe. Thank you very much.
Thank you, Dr. Richards. Dr. Hines will now provide us with an epidemiological report.
Okay, thank you, Mr. Alexander. Good morning to my colleagues, Dr. Richards and Dr. Sirju Singh. Today we're going to do a slightly different format of this epidemiological update and report, and we want to focus a little more on the global situation and then how that trickles all the way down to our personal responsibility. So I'm going to ask that we put up the slides that I've provided. So we're going to do global and local COVID-19 highlights. Next, please. And as you may be aware, globally, there have been nearly 59 million confirmed cases of COVID-19, including nearly 1.4 million deaths from the virus. That is a case fatality rate of around 2.36%. As of 4 p.m. yesterday in Trinidad and Tobago, there were 6,488 confirmed cases and 115 deaths, and that gives us locally a case fatality rate of around 1.77%. Next slide, please. Now, the global situation varies from one region within the WHO to the next, so that the next slide shows the contribution of all of the various WHO regions to the overall global picture. And the overall global picture here just emphasizes that across the world, we are continuing to see an increase in the number of cases. There's an uptrend in almost all of the global regions except for the African region at this point in time. And the message is that what happens globally can affect us nationally if we don't take the necessary precautions to prevent that from happening. So next slide, please. Looking at our local situation, what you would see is that if we look at all of the cases, all 6,488, especially those over the last week or two, we would see that there is an increase in that rolling average, the black line that runs through the graph. Within the last couple of weeks, we're seeing what appears to be a fairly steep increase. But next slide. If we look a little more closely at the last 21 days, we will note that as we have been explaining, some of that increase is due to particularly separated that out for better viewing, a better understanding of how that has contributed to the numbers and what our rolling average would look like in the absence of those cases, which is relevant because those cases being quote-unquote captive cases in a contained situation, in a contained environment, they did not arise from the population and they present a different level of risk from if the same number of cases had arisen within the general population. So right now we see that we have a daily average of about 33 new cases, not counting the ones that would have arisen in the prison system over the past couple of weeks. But we do note that there is still a gradual upward trend in that black line that represents the rolling 7-day average. So we are still advising that we hold the line, that we maintain all of the precautionary measures that we have been advocating in order to reduce risk of spread. Next slide, please. The next thing we want to focus on is the geographic distribution, and this hotspot map, so to speak, shows us the concentrations of cases by geographic area as opposed to by county or by community. So just equal land areas divided into those hexagons, and you see that there is a concentration of the redder colors in the most populated areas, east-west corridor, the boroughs and cities. And that is as expected. We see that the darkest hexagon is actually right there in the east-west corridor around the Arima area, and that would be because of the because of the number of cases that would have arisen within the prison system in that geographic area. So that's where that particularly darkly colored hexagon would correspond to. Next slide. Now, the more important thing that we want to give a little more attention to today, beyond the numbers, is the connections. So, next slide. One of the important things that I think we need to emphasize is that you can't test your way out of risk, so to speak, because you can test on one day and be negative yet incubating. So this slide, which is taken from a county health department in the State Department of Ohio, shows something quite useful and interesting. It shows you can be exposed to coronavirus on day 1. On day 5 of a potentially 14-day incubation period, you can be feeling fine and test negative. You can say, well, I've had a negative test 3 days ago and wander off to a gathering. In this case, they're looking at Thanksgiving gatherings on day 8 of your incubation. And then on day 10, you begin to have symptoms. Knowing that we can actually shed virus and spread disease even a couple days before we become symptomatic and without ever being symptomatic. We then note that the people who were exposed to the gathering on day 8 have all been exposed to an infectious coronavirus patient who tested negative when they did their test. So you can't test your way out of risk and say, well, I did a test, so I'm fine, I can go and hang out. That's not encouraged, and they're actually actively encouraging the U.S. population to forego some of the traditional gatherings around this time. Advice that seems to be being ignored if the travel stats for the U.S. Are to be considered. Next slide. Now, we tend to think that we know who we are around, we know where those people have been, and therefore we know that our circle is safe. But this is just a set of images to emphasize the circle you have versus the one that you think you have. This is your circle that you believe you have. You go to work, you stay at home. You stay at home with your partner and your child. You go to work in your workplace with a few people. But in reality, everyone is connected to a few other groups of people. So the circle you really have is a lot wider. If your child is in classes, the circle includes those people. Your circle includes the individuals at your partner's job, all the individuals at the small line that your partner might have gone to, that another member of your workplace may have gone to, the family groups of those members of the small line, the other exercise crews and people that may have interacted with that grouping. And the reason that we're showing this level of interconnectivity is if you have COVID-19 in one person in one of those circles, then you end up exposing all of the circles to COVID-19 in a very short space of time, just via that primary, secondary, and in some cases, tertiary level of contact. So while we do acknowledge that this is the season where we gather, the season where we want to have little office gatherings, family gatherings, because there is the continuing risk of having asymptomatic or mildly symptomatic people with coronavirus entertaining themselves in these gatherings, wherever they are, whatever setting they're found in. We do want to encourage all individuals to cease and desist from this gathering activity because it's going to accelerate spread as we move into the holiday season. So I'm going to end it there, turn you back over to Mr. Alexander.
Thank you, Dr. Hines. I now invite Dr. Surju Singh to bring us up to date on current issues relating to pregnancy and COVID-19.
Thank you, Mr. Alexander. Good morning to my colleagues, Dr. Miriam Abdul-Richards and Dr. Avery Hines. Of course, good morning to all our viewing and listening public. I represent the Directorate of Women's Health of the Ministry of Health, and we are responsible for ensuring high-quality health care is delivered to our mothers and newborn infants. So this is an update to the information on COVID-19 and its relationship to pregnancy and the newborn infant based on continued updated scientific evidence. I would also like to briefly mention some issues related to mental health and pregnancy as well as the seasonal influenza vaccination and pregnancy. Now, written information on COVID-19, influenza, and many other women's health issues can be found on the official Ministry of Health's website and social media platforms. As always, the disclaimer remains that the information is ever evolving and can change at short notice. Can I have the first slide, please? So on the screen, I have a slide showing the monthly births at all facilities in Trinidad and Tobago, both the public and private hospitals, for 3 years up to October 2020. There are 3 lines on that slide. The highest line on the graph is for the year 2018, the middle line is for 2019, and the lowest line is for 2020 up to October. So what that graph shows is that there's a seasonal trend in births, which tends to rise somewhere around August to September and goes into January of the following year. So the health sector, we prepare for the seasonal rise in births. What you can see clearly from the graph so far for this year, the total number of births have been less. Generally, we are averaging around 16,000 annual births. This year, we've had less, and also we are now seeing that rise, but we are well prepared for it. It's within the system's capacity. So we are saying that in our report, our maternity services, they've continued to perform very well during the pandemic. 3 years are represented, and we have, unlike many countries, our maternity facilities and services have continued to function, including both outpatient and inpatient services, such as normal deliveries, cesarean sections, as well as all of our newborn neonatal services. You can come back to me, please. So our benchmarks of performance, which we monitor continuously, namely maternal mortality and neonatal mortality rates, they are at their lowest levels in decades, which are all in keeping with the international targets set for the Sustainable Development Goals of 2030. Sadly, in many countries worldwide, there have now been many documented deaths in the pregnant women with COVID-19. Thankfully, our country is in a good place with no maternal deaths in Trinidad and Tobago from COVID-19 so far. We should be proud of this achievement. And of course, we hope that we can continue this record if we all understand that it's not a short race that we are in. This is a marathon. All our progress can be reversed if we fail collectively as a population to follow the public health measures. Can I have the next slide, please? So we have had, as you heard this morning, the update, 6,488 positive cases in our country. So it was inevitable that pregnant women would be affected. We have documented now at least 34 pregnant women in Trinidad who have been affected at different stages of pregnancy. I can't go into their specific details, but what I'd like to report is that all mothers and their delivered infants have been successfully managed in our public and parallel healthcare systems. Additionally, no baby has been affected or has had to be hospitalized as a result. In Tobago, I'm also pleased to report that there have been no pregnant women with COVID-19. Can I have the next slide, please? The scientific consensus has now shifted to state that there's a growing body of evidence that the overall risk of COVID-19 on pregnant women are slightly higher than that of the average healthy population. However, there's still minimal or little risk of transmission of COVID-19 to the unborn baby or to the baby after delivery. Additionally, there does not appear to be any risk of abnormal fetal effects in the babies in mothers who had COVID-19. Can I have the next slide, please? So, of particular concern are the following pregnant women with a higher risk of getting severe symptoms. These women include women who are overweight or obese. As you know, this is extremely common in our country. We have already talked about pre-existing medical conditions such as diabetes, heart disease, and so on. Being older when pregnant, especially in persons above the age of 35 years. And if you are in the last 3 months of pregnancy, also called the last trimester. You can come back to me. I want to remind the population that breastfeeding is allowed even if you have COVID-19, and your healthcare professional will assist you on how to safely do so. Reminder that babies and infants are not to wear masks or face shields, as this can lead to suffocation. I also again want to assure the public that the public and parallel healthcare systems are fully equipped and able to handle all the needs of mothers and babies who are COVID positive as well as those who need normal care. Next slide, please. This next slide deals with mental health issues and pregnancy. Slide 5. So 2 days ago, we had our mental health care specialists, and they reminded the population on maintaining our mental health during the pandemic. Now, our women, and especially our pregnant women, are at higher risk of the stresses involved. Anxiety, lack of concentration, general depression, as well as heightened coping issues when that baby is born. These are all normal features. I am reaching out especially to our males in society, partners, husbands, relatives. Please be supportive. Be aware of this. Recognize if your loved ones need help. Now, Dr. Othello and Professor Hutchinson, as I said, gave many helpful coping tips for yourself, including taking breaks, exercise, meditation, and yoga. No smoking. Avoid excess alcohol. Eat healthy. Avoid prolonged listening to bad news about COVID. Try new hobbies and skills. Self-learning. We use online courses at your own pace. My own wife, she finds art and learning new languages especially helpful. So if you need help, the Ministry of Health and the regional health authorities, they have published many helplines for you to get assistance. These are listed on the websites and, of course, the social media websites. Please speak with your family doctor or your healthcare professional. Talk about your feelings with your loved ones. Family members, please don't judge. Display empathy and help. Don't brush aside your loved one's feelings. And I'm just going to close up with a little reminder again on the influenza and pregnancy. I want to remind our pregnant population, please get that flu vaccine for this season's influenza strains. Every flu season, several pregnant women become critically ill and some have even died. Please forget those anti-vaccine armchair experts who have never been in a hospital to care for a pregnant woman with the flu. The vaccine is safe at all stages of pregnancy. The vaccine is available at all our antenatal clinics. There are over 115 of them in the public healthcare sector. And when you visit for your normal antenatal visit, you should be offered this vaccine. Get the vaccine early because it takes time to build immunity. Right now, we are only averaging 150 pregnant women every week taking the vaccine. We need to see higher numbers. The immunity is transferred to that baby before birth and as well as when you breastfeed. You're going to protect your baby as well. In closing, I want to express my heartfelt thanks to all our healthcare workers at the forefront of our COVID-19 response. Our country says thanks. Thank you for your attention.
Now move to the question and answer segment. As usual, we remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please ask both questions, one right after the other, to the relevant members of the panel. If time permits, we will facilitate a second round of questions, and at that time, we will take 1 question per media house. Today, we begin the question and answer with questions from CNC3.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question, Dr. Serju Singh. I remember back early on in the pandemic period, you all said that you were anticipating a large baby spike coming into 2021 because of the lockdown measures. So with the information that you have now, is it that we're not seeing that anymore? And my second question is to Dr. Richards and Dr. Hines. So you all are anticipating a COVID-19 spike early next year following Christmas and New Year celebrations. So given whatever trends and stuff you all would have been seeing, observing in the parallel healthcare system already so far, could you paint a picture as to what it is exactly you're expecting to see early next year and how bad it could possibly be?
Question. Yes, I do recall saying that we are well prepared. We are anticipating persons confined to their homes and other issues with lack of access to contraception, that there may have been a spike. We're not quite out of that area as yet. That spike may actually come a little later beyond the traditional rise in births that we see from around September to January. So what we'll only be able to tell as we keep monitoring, and we'll be getting the data for each month. We usually get that by the 15th of each month. We're also monitoring the antenatal clinic visits, and we actually haven't seen a spike in the antenatal clinic visits. The bottom line is we're well prepared for anything that hits us at this point in time.
Good morning, Rashad. Thank you very much for that question. The parallel healthcare system and the test of the management of the parallel healthcare system is based on occupancy levels at our hospitals. As you may be aware, the percentage of persons with COVID-19 who would require hospital care would be approximately 15% for high dependency care and 5% for ICU level care. In Trinidad and Tobago and in the parallel healthcare system, our limiting factors would be considered hospital beds. That is the hospital beds that are spread across 7 hospitals in Trinidad and Tobago. Daily, the Ministry of Health tracks or monitors the percentage occupancy and the number of patients in each of the operationalized facilities under the parallel healthcare system. Thus far, since the relaxation of restrictions on or around the 24th of October, the overall occupancy of the parallel healthcare system has been between 11 and 26%, with an average of about 17%. The wide range in terms of the occupancy or the overall occupancy is really due to the increased numbers when there is a repatriation flight. The 26% upper value really represented a week when we had over 300 persons repatriated. Of course, this does not pose a significant pressure on the parallel healthcare system in the short term or immediate term, because these persons are not considered as high risk as those who would be in hospital. In terms of the overall ambulatory capacity, that has been between 15 and 19% since the relaxation of restrictions, with an average of about 17%. The HDU occupancy on average has been around 8%. Our highest range, which was an outlier, was somewhere between 23%, and for several days we actually had an average of 0%. That is no HDU patients spread across any of our 7 hospitals. ICU occupancy is at 11%, and that is between 8 to 13% on average. Again, we've seen a downward trend over the last 3 to 4 weeks in terms of hospital occupancy levels. Now, this downward trend should not be considered or identified as a factor for our population to become more complacent. The number of ICU beds in this country currently is at 37, and we can upscale to 91 beds. At the Ministry of Health, we view an occupancy rate of approximately 70% as being a red flag or a trigger that the parallel healthcare system may be overwhelmed. As such, at that point in time, decisions need to be taken regarding the incoming number of persons and repatriations, as well as policy measures that are done based on science by an expert panel. I will now pass you over to Dr. Hines, who will discuss the epidemiological trends that guide decision making. Thank you.
Okay, thank you for the question, Mr. Khan. Now, you asked what we look at or what we may be projecting going into and past the Christmas season, and we are hoping that the behaviors that we demonstrate during the Christmas season do not lead to the kind of spike that is possible if we proceed as we have done normally in other Christmases past. So if we are not careful, if we are not adherent, then we can actually run into a situation where we start to overload our healthcare capacity even before the end of the year, even before the Christmas season is finished, if we do not make an extra effort to adhere to the guidelines, adhere to the restrictions in gatherings, adhere to the physical distancing, the hygiene, the mask wearing. And we are hoping that this is not going to be the case. We are expecting that good sense will prevail and that the number of cases that we're seeing arising in the population now does not begin to increase sharply. We will see whether this actually holds out or not as we continue to monitor the data, to maintain the surveillance, to maintain the testing that we're doing. So it would be a little preemptive to try to give figures around what we project, but it would be remiss of us not to advise and to take the opportunity to remind us all that what happens on the other side of Christmas is very, very much dependent on what we do now and leading into the Christmas season. So this is not the time to put our guard down and fight it. In fact, it's the time to fight a little harder to ensure that we keep the numbers down, reduce the risk, and we can continue to enjoy remote and physically distanced and maybe telegathering related Christmas season as opposed to a physical gathering one. So that's good. That's my short and long answer to the projection question at this point in time. As we see trends emerging, of course, we will update the population accordingly. I turn it back over to Mr. Alexander.
Thank you very much, Dr. Hines. We now go to AZP News.
You're muted.
My first question is for Dr. Richards. Doctor, the Prime Minister said a few weeks ago that we were going to have a tagging system where people can leave and can come back and they can be tagged, and when they return they'll return home and self-isolate, etc. Can you give us an idea if that is still going to be implemented and what is the latest with that? And to Dr. Hines, Dr. Hines, when we hear about these two vaccines that have been developed, and we also hear that COVID-19 mutates, would those vaccines be effective if there are different strains of the vaccine? Thank you.
Thank you, Prior, for that very topical question. The decision to use an electronic or monitoring system for returning nationals or persons who are under surveillance or as being primary contacts or persons with COVID-19 that are sent home for self-isolation really rests with an expert panel of persons from different ministries, for example, the Ministry of Health, Ministry of National Security, and the Attorney General's Office. I would prefer if that question is referred to the Honourable Prime Minister or to the Minister of National Security or Health, since this is a policy decision that has to be taken by an expert panel taking regulations and government legislations into consideration. Thank you.
Okay, thank you for your question on the vaccines. Now, very well noted, in all cases, viruses are rapidly mutating pathogens. They can change, and we cannot predict exactly how a mutation will affect the efficacy of the vaccine. What we can do and what is being done at present is that the vaccines that are being produced to meet and to match the existing pathogens as they are configured at this point in time. So once there isn't a very massive change, a huge genetic alteration that makes the virus unrecognizable to the immune system, then the vaccine will still continue to confer some level of protection, even if there are minor mutations along the way, because mutations do happen almost continuously. Each time a virus replicates, some of its DNA, RNA, genetic material may be altered by the process of replication itself. But even within that process, the changes aren't massive enough to change your immune system's ability to recognize them over a short space of time. So we believe that in the time frame in which a vaccine will arise, the vaccine should still be able to cover the virus that is in circulation at that point in time.
Thank you, Dr. Hines. We now go to CL Communications.
Good morning. Vivian Bowen, Caribbean Lifestyle Communications. On Monday, we spoke at length about the mental health issues that is affecting the general population and where persons can go to seek intervention. Today, I would like to know what program does the Ministry of Health have set up inside the prison system that can help deal with some of the hunger strikes, clashes with the officers, that might even mitigate a potential prison riot, considering that we know that the prison will always be a place ripe for mental health issues. And my second question has to do with the ZESA and the weddings that was happened over the weekend. Have the Ministry of Health reached out to these people, asking them to, home quarantine or anything of the sort? Thank you.
Okay, thank you for the question. Now, the first question regarding the mental health aspects that are available in the prison is really more a question that should be addressed to the prison services themselves, but the Ministry of Health does stand ready to and does already have some measure of mental health support available to other governmental agencies, other ministries. So as need arises, that mental health support can be provided in specific situations. I believe it has been done in the past, and we stand ready to continue to do that, although the primary responsibility for the prison system, both the inmates and the officers, actually lies with the Ministry of National Security. Now, the question on quarantine was asked on Monday with regard to the individuals present at both gatherings. And the answer then hasn't changed. Without an actual case of a positive, we cannot then initiate what you would call preemptive quarantine just on the basis of the fact that people were in a gathering. What will happen, though, is that the ability of the contact tracing to be done in a timely fashion is going to be augmented by outreach to both groups in terms of getting into contact with participants in such a way that we are able to facilitate additional monitoring for symptoms, facilitate the ability to pick up in both groupings whether any symptomatic individuals then require testing, whether they turn out positive, whether additional contact tracing will be needed. So that outreach is already being planned and underway, and that will continue as we monitor the potential occurrence of symptoms over the incubation period, which is another 2 weeks.
Thank you, Dr. Hines. We will now take questions from Wired 868.
Hi, good morning, everyone. This is Fayola Bostic from Wired 868. My first question goes to Dr. Richard, and I guess Dr. Sergio Singh as well can jump in. The question is, with the parallel healthcare system drawing from the normal public health system, have we been seeing any impact in terms of wait times or workloads of medical staff within the normal public health sector, and what measures are in place to help medical staff deal with that? And my second question is for Dr. Hines, and this has to do with the vaccine, or the future vaccine, whichever one. We have three now, one from AstraZeneca, I think, and Oxford. Yeah, so we have been told that about 33% of our population will be vaccinated, whereas the chief scientist of the WHO has said we would need within 60 to 70% of the population to get herd immunity. So if we're not going to achieve herd immunity, what do you see as being our end game in terms of this vaccine? Do we need to continually take these measures of mask wearing, social distancing into the long term? What do you see as our end game as with regards to the pandemic?
Okay, thank you for that very important question, because given the emphasis on COVID-19 and the parallel healthcare system, we have not really been asking many questions on the traditional healthcare system, which continues to operate alongside the parallel healthcare system. We have put measures in place based on COVID-19 mitigation measures to reduce the risk of COVID-19 spread amongst persons attending the traditional healthcare system. That is persons, for example, who attend health centers, accident and emergency rooms, and persons who are attending clinics in our traditional hospital. Firstly, we have to note that anyone or most persons who are attending a hospital in the parallel healthcare system would possibly have some risk factor that would increase their risk of contracting the COVID-19 virus and having an adverse outcome that is requiring additional medical care, such as a high dependency unit bed or an ICU bed. With this in mind, we have decreased our clinic numbers to prevent persons from congregating. This may have led in some instances to longer waiting times for clinic appointments. However, we have prioritized clinic appointments based on the severity of medical conditions, and in some instances we have added additional clinics to reduce the backload of patients. With respect to the workload of staff, the Ministry of Health has advised the regional health authorities, who are responsible for the service delivery in the traditional healthcare system, to initiate mechanisms of a shift system to allow persons to not have mental or a burnout sort of scenario. There has also been an increase in mental health services and employee assistance programs geared towards staff who continuously feel that they may not be able to cope with the situation and challenges around the COVID-19 response by the Ministry of Health. With respect to the human resource capacity, we have increased the staffing on the parallel healthcare system to reduce the burden or to reduce the likelihood of persons in the traditional system being transferred across to the parallel healthcare system. Additional positions were created and approved and funded by multilateral agencies as well as the government of the Republic of Trinidad and Tobago to increase the number of physicians, nurses, and other support personnel within the parallel healthcare system. This prevented the loss or drain of human resource personnel from the traditional healthcare system. So in summary, the Ministry of Health has implemented measures to reduce the burnout of staff with respect to additional human resource personnel, and also measures to mitigate the spread of COVID-19 while continuing care in the traditional healthcare system. Thank you.
Thank you, Dr. Rich.
Thank you for your question, Ms. Bostic. It's an excellent one. It's a very topical and a very relevant question. Now, the vaccination strategy that is being employed is not one that is aimed at generating population-wide herd immunity. That's quite correct. It's a very good observation, a good point that needs to be emphasized. The strategy with the vaccines is really to do two things: protect the vulnerable, i.e. the individuals who may have an increased risk of an adverse outcome because of pre-existing conditions, and protect those who are at high risk of exposure, frontline staff at hospitals and at in other agencies and settings where there's a lot of forward-facing, front-facing, crowd-facing, public-facing staff, people that are going to interact in large volumes with numbers of people passing through the system. And in so doing, we are hoping that we reduce the risk of super spreader events by preventing individuals who, by nature of their job, come into contact with lots of people from spreading infection, and we want to reduce the potential for adverse outcomes and death. Now, you're quite right in looking at this as just one additional layer, one additional tool in the health responses armamentarium to respond to the public health crisis that is COVID-19. It's going to support the testing, the tracing, the isolation and quarantine, and it's going to support the measures that we all take as individuals to reduce our risk by having the physical distancing, the mask wearing, the hand sanitization and hygiene, the avoidance of gatherings when we're ill. So it's another layer. It does not in any way replace the need to do all of these things in order to reduce risk. But what it should do, hopefully, is reduce the potential for some of the surges in either deaths or cases based on our protection of targeted groups. So thank you for the opportunity to go into that in some detail.
We now go to the Express. Express? Okay, we will come back to the Express. We'll move to Tobago, Channel 5. Channel 5.
Hello, what should I do? Sorry.
Okay. We'll come back to Channel 5. TTT, are you ready?
Yes, hello, morning. Can everyone hear me?
Yes. Go right ahead.
Hello, morning.
We're hearing you. Please proceed.
Hello?
Please ask your question.
All right, I'm going to go ahead with my question because I'm not hearing you. But I have two questions for Dr. Serju Singh. Dr. Serju Singh, since we're seeing a decrease in the birth rate, I'm just wondering if the ministry is concerned about the population growth and if there's anything that we can do to encourage population growth. So, for example, I know some countries almost offer an incentive where they invite, families or couples to procreate. Is the ministry looking at that as we think about population growth? My second question is, Because we have a growing immigrant population, and of course we have mummies among that population, is there anything we can tell to our TNT nationals to kind of put them at ease? Because they may be thinking that because we have that growing immigrant population, this system might be a bit overwhelmed. So is there anything you can put or you can say to, put our nationals or TNT nationals at ease as they, go out to have their children? Thanks.
Thank you.
Dr. Serju
Yeah,
Singh.
Dr. Serju Singh.
Yes, so essentially, the first part of the question actually is probably way above my pay grade to answer. I'll be diplomatic about it. Of course, this is a dynamic thing. We are not so certain what will be the effect of the number of deliveries as we go into the new year. So we'll have to look at the data and then make those decisions. But we are expressing some concern. Now, in the second part of the question with respect to migrants and the ability of our hospitals to cope with deliveries and newborn care, I just again want to reassure the population that we actually have capacity to deal with at least 25,000 deliveries on an annual basis. We have infrastructure, we have resources in terms of the nurses, equipment, consumables. On an annual basis, we have catered for this. So if we are running at current capacity of below 16,000, there is significant excess capacity to deal with any migrant deliveries that we are seeing at this point in time. And we are continuing to actively monitor it. Thank you again for those questions.
Thank you, Dr. Serju Singh. We quickly go back to the Express.
Good morning, Kim Mudram from the Express. Sorry about that, not sure what happened there. Either of the doctors could answer my first question, which is the minister only yesterday spoke about using the law to tackle private versus, we won't get back into that, but large gatherings that people ought not to have. So that was only yesterday. So has there been any discussion about that? If not, if so, what would those talks look like? A few highlights going forward as to what the health experts like yourselves would recommend as to how the authorities could safely, within the law and effectively, begin to put a stop to that or monitor that. Also, my next question, is there any way, without intruding on patients' privacy, of getting an idea of the overall health of the inmates who have been infected with COVID-19, what the comorbidity rate, for instance, might be among them? I think we got some idea of the age group from Dr. Hines recently. And if at all there's any insight into, let's say, the overall inmate health situation, what's their overall health like at all? Thank you. I hope that was clear.
Okay, taking the first part of the question, any decisions or movements towards having any legislative change would really fall within the purview of the Ministry of Legal Affairs, the Office of the Attorney General, in consultation with the Ministry of Health, Ministry of National Security. The whole concept of making a legislative change is one that would lie at the policy level with the ministers. So we would not presume to predict or preempt what that step might look like. But it's the time to re-emphasize that we do not need to have a law that prevents people from gathering in their private settings in whatever socioeconomic group, in order for us to know that we need to do the right thing and do the sensible thing, which at this point in time is not to gather. So again, we want to emphasize that the virus does not discriminate between public and private settings. It does not discriminate between socioeconomic groups. So with or without a law in place, we do want to take the opportunity now to re-emphasize that we all need to do the right thing just because it's the right thing to do. And the right thing to do is to maintain the physical distancing, maintain the mask wearing, maintain the absence of gatherings, reducing gatherings to fewer than 10 people, the hand sanitization, not going into workplaces or other gatherings when you are ill. This doesn't require a law. This requires good citizenship. And this is what we would want to ask everyone to exhibit. Mr. Alexander? Actually, I think Miriam wants the next question.
Yes, regarding the question that was asked about the prisoners and their medical care, the medical care and management of COVID-19 in the prison population is really carried out by the medical personnel that are attached to the prisons, and they are guided by the Ministry of National Security as the lead agency. With regards to the issue about the medical conditions of persons in the prisons, we are guided by confidentiality rules in terms of medical ethics in disclosing such information for the inmates. What I would like to reassure the population in knowing is that if, for example, a prisoner is requiring care, that is hospitalization for a severe or critical sort of deterioration for COVID-19, they are managed in the parallel healthcare system by the Ministry of Health with the necessary security measures. So thank you.
Thank you very much. We will now go to Tobago Channel 5. Is Channel 5
Hi,
here?
good morning. Candice Jackson from Tobago Channel 5. My question is in regards to the increase of gatherings that we're seeing. We're seeing some persons continuing to gather despite the instructions coming from the Ministry of Health and so on. But I'm wondering if you guys are considering making recommendations to perhaps, in the same way that Canada has some restrictions now on gathering, to where only your family members, if you live alone, only one person.
We seem to have lost Tobago Channel 5. Was it sufficient enough to answer the question?
So this is a very similar question that was just posed to Dr. Hines, and any sort of policy change which is guided by legislation will emanate out of the expert opinion of the ministers and the Honorable Prime Minister. And in this case, such a change would require the intervention of the Minister, the Prime Minister, the Attorney General, the Ministry of Legal Affairs, the Ministry of National Security, and the Ministry of Health. Thank you.
Okay, I think we may just have time for just one more question. TV6, quickly.
Hi, Vanessa Cutting, TV6 News.
Yes, we're hearing you. Please ask the question.
Hello.
Go ahead, ask the question.
I'm not hearing, but I'll just ask the question on the issue of this COVID situation at the prison. How closely is the Ministry of Health working with the Ministry of National Security and the Prison Service in managing this situation as the experts and the authorities on all things health? Or is it that officials from the Ministry of Health at least visit maybe twice a week or so? How closely is the Ministry of Health working with these agencies to ensure that this situation is in fact under control? As the Ministry of Health said, it is a contained situation. How confident are you that it is in fact contained? And my other question was, I know yesterday the Minister of Health would have indicated that public health officials will be accompanying police officers on operations to enforce the regulations. Could you say what type of parameters they'll be operating within, specifically where it concerns private property, please? Thank you.
Okay, Ms. Cutting, again, another interesting question regarding the prison system. So, as I indicated earlier, the medical management of prisoners falls under the Prison Medical Services. There are physicians attached to the prison's medical services, as well as nurses, orderlies, and medics. The Ministry of Health provides support with respect to laboratory testing, monitoring and evaluation, surveillance, and also in terms of technical cooperation, that is in terms of guidelines for prisoners. So there is a collaborative relationship between the two ministries and the prison system in terms of curbing the spread of COVID-19 amongst this vulnerable population. With respect to the interaction between public health officials and the TTPS, the Ministry of Health again will be guided by legislation and regulatory changes that are led by an expert panel. Thank you.
Thank you very much. Ladies and gentlemen, we have come to the end of today's media conference. Thanks to everyone for your participation. Remember, the flu vaccine is available at all health centers free of charge. Get yours now. And as we celebrate the Christmas season, please protect yourself and your loved ones. As been said many times, remember to adhere to the simple guidelines that we at the Ministry of Health continue to reinforce. Wash or sanitize your hands and clean frequently touched surfaces. Maintain at least 6 feet physical distance from others, and wear your mask the right way. Ensure that it covers your mouth, nose, and chin.